Women who suffer from stress incontinence, unfortunately, they suffer too long. In identifying patients that may be eligible for surgical correction of stress incontinence, I think it's about having an algorithm. It's about having a process. It's about treating all patients in a uniform manner so you can evaluate them consistently. For me, that's a multi-step process. It's first obtaining patient history. It's really determining what is going on and determining what is the primary problem just based on history. Then it's obtaining a physical exam to evaluate the patient to determine if they have a pelvis which is appropriate for surgery. Do they have contraindications? Do they have urethral mobility? Do they have essentially prolapse or other things that may play a role in it?
My journey with stress urinary incontinence really began after my second daughter was born about 2.5 years ago. I spent 2 years working on strengthening up my pelvic floor and unfortunately got very little to no improvement. I knew SUI was a problem for me when I started not being able to enjoy all the activities that I love doing. Hiking, biking, playing with my kids, simple things like lifting them up or chasing them around the park became very worrisome for me. I had to constantly think, is this something I should do, or am I going to have a bladder leakage issue? Can't cough, can't sneeze without crossing my legs. It became really daunting and very stressful, and that's when I knew something needed to be done. I would go through 5 to 6 pads every day. If I had a bad day, it could be upwards of 10 pads. What caused me to finally decide to do something about this was just how daunting it had become in my everyday life. I thought, I'm 34 years old. There is no way I'm going to deal with this the rest of my life. I want to enjoy my activities. I want to enjoy my family. I do not want to have to worry about this problem. So I made an appointment right away. My physician and I discussed the risks and benefits, and he helped me to understand what my recovery would be like. He basically told me I'd have a small amount of pain the day of surgery, somewhere in a 2 to 3 on a scale of 1 to 10. And in his explaining, there was just a sense of calm that came over me because he made it seem like it was really gonna be an actual fix for this problem that I've been dealing with for so long that it stressed me out. I almost cried in his office. I was so excited that there was actually something finally out there to help with this.
I started having issues with stress urinary incontinence shortly after having my twins, and then it definitely got worse after having my 16-year-old son. Progressively throughout the years, it just seemed to continue to get worse every year. My tipping point for wanting help was jumping on the trampoline with my friends' kids, and it was not a good experience, and that's when I realized that this was a bigger problem than I originally thought. I wanted to get my life back. I wanted to be able to exercise again. I wanted to be able to play with my grandkids again. I wanted to do the simplest of tasks, just working every day and not having that extra weight to have to deal with. I work with Dr. Benson and had seen what he has done for other people and the procedure and how it works. Him and I sat and discussed it thoroughly. And so I knew that the Solyx Sling was what was going to be most beneficial for me.
In describing Solyx to my patients, it's in relation to all of their options. And I think that for me, it's about describing the entire problem and then offering that as an option within the problem evaluation. So when I discuss Solyx, I'm an advocate for it. I'm really discussing for them what I think are the attributes that set it apart from other slings. So my discussion really goes into the history of slings, talking about what we did before slings, talking about alternatives to slings, and then within slings, talking about the generations and the development, and really what led to where we are today. And I think that gives patients a roadmap for how it is separate and works differently than other associated slings. And so for patients, it allows them to make, I think, a really clear decision on what they're looking for and why this is different.